some prevention. And our goal really is for prevention. That's really, really our goal today is to talk about a way to have prevention of kids going into the system. So before I say anything else, I'd love to just do a quick introductions. And Michael, you want to go first as we kind of tag team this?
Sure. Good morning, everybody. Good morning, Pastor Dan. My name is Dr. Michael Rauso. I am the Regional Administrator for the Santa Clarita office in Los Angeles County.
And great. I'm a pastor at Valencia Hills Community Church. I can see Magic Mountain off the Freeway if you've ever been there. That's where I'm located. And I help oversee a program called Family Stress Support. And it's a program that we'll talk a lot about today. And I'm a pastor and an MFT. So I'm like a translator between these two worlds of the faith world and the kind of social service world. So I'm gonna put some slides on the screen here. And so our hope behind this is prevention, and there'll be some amazing numbers that you'll get to see what's been happening in kind of our region. And so what we're trying to do is really talk about how to help empower the community. And obviously there's a need for social services, there's a need for kids when there is abuse and neglect, but there's a lot of times that prevention can make such a difference and make a world of difference of kids before they even enter the system or even in that first like initial referral that comes out. And so this will be also a discussion between kind of the faith community and social service community, how to collaborate together. And Michael Russo has been an absolutely amazing partner on knowing how to collaborate and how to kind of connect. So I'd like to start out, Michael, do you mind sharing a little bit of your history of trying to connect with the faith community and some of the challenges and then what's kind of led up to us and what we're trying to do?
Sure. So I've been with the department for 22 years. Most recently, I've been in the regional field offices the last 10 years. And one of the things that I tried to do in a previous office was engage the faith-based community. And I was in downtown LA. For people who may not know, this is where our Skid Row is and our most densely populated area. And we have a lot of churches, very small and very big, to try to get them to support us, because part of what we say, at least in DCFS, is we know there are community strengths and we can't do this job alone. And the idea is the better we do with our community, it can reduce the number of children that actually come into DCFS. But also, if there's a community to receive the child and the family, their time in DCFS is shortened, but also they'll never come back to us. So a lot of work went into trying to engage the faith-based community, and it didn't go very well. A lot of our faith-based community partners said, child welfare, you always seem to come to us when you want something from us. So unfortunately, it didn't work really well. And then I was able to join the Santa Clarita office 5 years ago, and I was introduced to Pastor Dan Broyles. And Pastor Dan and I went to lunch, and then we started meeting regularly. And it was great because there were several things that we had in common, including a desire to put DCFS out of business.
Yeah. So one of the things that I've seen, and I have worked in both of these kind of worlds, is unfortunately, there is what I would call a great deal of suspicion between these two worlds. And I haven't seen always, there's exceptions out there between the social service world and kind of the faith community, and there's assumptions and all sorts of stuff. And so what I truly believe though is there's some things definitely that both groups can agree on significantly. We want less abuse in our communities. We want less kids in the system. We want kids to have more stability in their growing up experience. And so these are things that actually can be agreed on and that there can be this joint effort. And so that's part of what's behind this, is that those are definitely things that whatever faith community you're coming from or whatever social service office you work at or whatever your titles in that world, that this is something we can agree on, but how do we do it together? Because they're both trying to make a difference in the community. Both are trying to make a difference in the community, even though, yes, there are some different approaches that done and different ways of maybe thinking about some things. But these, with children in the system and prevention, that is something that we can all agree on. So, um, unfortunately, what I have seen is it's almost like crossing the other side of the tracks. Often there's not even, I would say, healthy conversation between those two worlds. And even in my own community, I'll see a church doing like a foster care support group, and then the DCFS office not even knowing about it. And because there's this, I think, what are they going to do? Or what about this? Or what about this? And it honestly is really not best for the community. It's just kind of what's happened. I don't think anybody intended it for it to be that way. I just think through many circumstances, it's been an issue. And I know there's exceptions. And I love those, hearing about those exceptions. And so, the research also has been really clear. There's some really amazing authors out there that actually talk about this. One of my favorites is Dr. Holly Oxhandler. She wrote the book, The Soul of the Helper, that actually talks about like clients wanting to go to therapy, that 2/3 of them that they were talking to in this one survey actually wanted their spiritual beliefs to be part of the mental health practice or conversation. And so often they're so separate, but a lot of people will actually see them have actually benefit for each other. And she's done a lot of research out of Baylor University. And then another one is Lisa Miller, probably my favorite author on this whole thing. Um, Talks about teenagers who have the highest rate of spirituality, have higher, so much better in less depression, less anxiety, less substance abuse. And so, again, those are things both social service and a faith community can agree on. We want less substance abuse in our community with our teenagers, with our young adults, and anxiety, depression, and those numbers are off the charts tragically. And so, how do we help that, and maybe in some different ways? And so, what's happened is we formed a program called Family Stress Support. So, Family Stress Support is a program that has been going now for about 3 years or so. And another way of thinking of family stress support is case management. However, the case managers are not DCFS or social service employees. They're actually employees of the church that I'm a pastor at, which is a different way of doing this. And so what happens is, and I'll give you the kind of the layout of this, is this would happen to me as a social worker. I had this happen so many times. So a school would make a referral, a neighbor would make a referral. The social worker goes out. They have to make a decision within 30 days about, is this conclusive or not, substantiated or not? Is there abuse or neglect? And what would happen is, in 90% of the time, I felt like I was an ER worker myself for Santa Clarita office. I would get ready to close out the referral. I would hand a piece of paper to that family with nonprofits, food pantries, mental health agencies, and say, here's some referrals. I hope you get some more help, and we're closing out your referral. Now, I'm not sure what you think, but what do you think the chances are, once that referral is closed, that the family went ahead, called those numbers, the nonprofit responded well, and the people got the help that they needed, or the families did, or that single parent? Everybody I've ever asked, I think the highest number I get is about 10%. But usually people say 2%, 5%. And I felt like that was my experience as a social worker, where that piece of paper is given out. And then about a year later, I'll get a referral, and I would say to myself, this address looks familiar. I think I went out there about a year ago. I would go out again. I'll look at the old notes on the system, and I'll be like, wait, oh, hey, that referral we gave you, any chance that happened or any follow-up? And they're like, no, we're busy. Life happens. And there'll be nothing done in that way. And some of those problems then have gotten worse. And some of those numbers have gotten worse. And so basically what we want to provide now, instead of providing that family a piece of paper with a list of resources or a bunch of websites, we want a person to handhold the family, to be a bridge between the needs of the family and community resources. So like in our area and like other areas, across California, other states, there's some amazing nonprofits out there, but there's a gap between what families know and what's actually available. And so we want to be in that bridge, the family stress support case manager, to be in that bridge to advocate for needs of the family in creative ways. And the nice thing is because they're employees of the church, there's far less red tape. They're actually seen in a more positive light than the social workers from the county, even though there's some wonderful social workers for the county. Just because of the title alone and perceptions are real, they're more receptive to the case managers maybe than the LA County social worker. Even though the social worker can be so professional, so compassionate, it just is heard differently. And so what we've found is these families are getting help, and then those families, then there's not the repeat phone calls coming back to that DCFS because now we're helping them, and the number of phone calls to the system has gone down and has provided all sorts of benefits to our local social service office. And so I'm going to turn it over to Michael to any thoughts you want on what I just shared, and then obviously after that, some of the numbers of what you've seen in your office.
Yeah, no, absolutely. Thank you. And it's been fantastic. So part of what we've also been clear about with the community as well as our own agency is that these are general neglect situations. So when we get a referral at DCFS and my staff look at it, and then they may even meet with the family, and we realize that this isn't something that rises to the level of needing DCFS intervention, we will refer to Pastor Dan. We also have worked very cooperatively with the schools, and the schools will refer directly to Pastor Dan. So we've actually created, I joke, we created a force field around DCFS in many ways. So only the absolute needy families that need our intervention are getting our intervention. And what that has resulted in a dramatic decrease in the number of children in the Santa Clarita office. Because we know general neglect, unfortunately, has a larger impact on children of color, socioeconomic status. There's a number of different things that we know happen for those general neglect cases. We get calls from neighbors who don't like the family for whatever reason. And we also know that the trauma of DCFS going out and knocking on the door for a lot of our families can be avoided if at all possible. So Pastor Dan, I don't know if you can go to the slides and I can show them the numbers of what we've been able to achieve together.
There you go.
Okay, I can't see anything yet. Oh, okay, perfect. So in the Santa Clarita office, since we started doing this, and I don't know how many people are child welfare, but I'm just going to explain this very quickly to everybody. This is looking at our permanency for children 12 months or above in care. So these are our children who have been with us for at least 12 months. And historically, DCFS has seen children stay sometimes a very long time. But what we've been able to do with the help of Pastor Dan is really focus on the children and really make sure every day in foster care is an urgent day. And as you will see in this slide, we've done a really great job in getting children out of DCFS that have been in care 12 months and longer. The next slide, please. And the same thing is for our children who have been here even longer. So by controlling our front door, we have been able to spend more time with our children who have been in here longer. So this slide you're looking at is what we call P3, which is permanency for children 24 months and above. And as you can see, we are beating the federal standards for that as well. And you see an upward trend in this slide. And again, it's all because we are controlling the front door better and we are able to look at our families in a different way and honestly with more time. So the average caseload in the Santa Clarita office is 8. When I first got there, we were roughly around 27, and we in the past 5 years have been able to get it to an average of 8, which is the lowest that I've ever heard of, as well as we've had a 67% reduction in the total number of children in care. And that has been contributed to what I just showed you in the P1 and P2. And then if you go down a little bit, you can see the 7 federal measures we have been able to achieve, um, exceeding the federal standard in all 7 of those measures. And then the next slide will show you exactly kind of what, oh, go down a little bit more, please. Is that we've had this dramatic change. And this graph only shows you a small part. When we first started doing this, we were over 1,300 children in the Santa Clarita office. So all that to be said, we've had a dramatic decrease in the number of children in care, but we've also seen that the social workers are so much happier because what they're able to say and do is the social work that they've always wanted to do. So the children that are left in our care are the children that absolutely need it, but also they're getting the care that they've never received before. So we're able to do things that we've never been able to do before, which is resulting in children leaving us quicker and achieving permanency and not coming back. So if you can scroll down one more, I think there was another thing. And the biggest thing, which I'm personally so happy about, is that we have no children in residential care. This is a first for us, first for LA County, in that we've been able to keep children out of residential care. And it's now over 6 months that we've been able to achieve no children in an STRTP. I'll stop there because I know I just threw a lot of information at you, but it's something that I and I know Pastor Dan are very excited to share with you because we believe every office, every county can get to this. And this partnership really has been a major component to all the numbers that I just shared.
I just want to pause. Any before we go to the next part, any questions or comments? I'd love to have any open dialogue about any numbers or thing you want to ask to clarify with Michael about what he thinks helped or clarify some of those numbers, that type of thing. All right. So what's happening is I would say almost every day of the week I get some family or families from DCFS to assign to one of my case managers. I have 9 case managers now, and we cover the Santa Clarita office, and we actually took on San Fernando Valley here a number of months ago. And what we're finding is families don't know where to turn, and what we're finding, especially kind of post COVID, is there's just a lot of isolation and loneliness, and almost lack of what I would say almost like natural community support or extended family support. And so they don't know where to turn. And it actually, obviously, as we know, when families don't have any place to turn, there's so many more needs that pop up or challenges that happen because every family needs support in some ways. And so, for family stress support, our case managers we don't just help them for like a few weeks. We don't have a cap date. We might have helped them 6-8 months. So we help them, but then something goes away and then they pop back up and we help them some more. And it's hopefully prevention as a way to help. The other thing is that has been growing is we don't just get referrals for family stress support from DCFS ER workers. We sometimes get it after actually they've had an open case, they're getting ready to close that case. They've been open for, let's say 12 months with whatever the issue was. And now they're getting ready to close it out. And the social worker's a little nervous closing it out because there's just some vulnerabilities there. And so they'll send the family. And then the other thing is we are getting families from local schools. So here's what I have talked to a lot of school counselors about. They'll say this: if nothing is done in the next year or two, I'll probably have to make a referral to DCFS because they can almost see the writing on the wall as the children get a little older. There's more issues. The issues kind of compound on top of each other. And what they'll do is they'll end up sending us the families, and then we can kind of intervene. And then they end up not having to make that referral to DCFS. Again, we're all for making that referral when needed. If there's some, some clear evidence of abuse, it doesn't come to us. It goes straight to DCFS to do the work that they need to do. And so the other thing is we never do anything court ordered. It's always voluntary, and that type of thing. And so whoever gets referred, the professional who refers them, it could be a school counselor, a nonprofit worker, a DCFS worker, always gets permission of the family first. So it sounds something like this. There's a program out there called Family Stress Support. They can help you with some of your needs. They're not DCFS, but they can be an advocate at your pace of getting more support for your family if you would want that. And if they say yes, they agree to that, then the social worker goes online, fills out a small form, it goes to my email, and then I then pass that on to one of my case managers. One of the other things I want to help just kind of clarify that I think some people were a little bit nervous at first because it's a little out of the box is the whole, what about like church and state? And the religious part of stuff. And for some people, they don't even think about that stuff. Some people, that makes them nervous. And so one of the things we've gone about, just because I've worked in both fields, I realize that that can be a sensitive issues for some people, but it's also for some families, it's a strength. It just so depends on the family. So what we found, and we do, is that every time we connect with a family, during the first conversation that a case manager is connected with the family, we just get to know the whole family, the whole person. And one aspect of family life or someone's life is asking about faith or spirituality. And we'll ask something like this. If we end up finding a resource that could maybe benefit your family, but it's faith-based, are you interested or not really interested at all? And we will respect you either way. However you want to go about that, we'll go about that. Now, if they say not our thing, then we don't go there, and from then on out do not offer any faith-based resources. Right? We're just going always at the pace of the family. Now, honestly, most families are like, they don't really care where it comes from if it can help them. They'll say, I'll take whatever you get, whether it's faith-based, whether it's not, you're just your standard nonprofit, whatever it is. But what we found is, again, we're sensitive to this. We might know of a faith-based resource that's down the street from that family they didn't even know about. And then we'll offer. Say, here's an idea. It's always a suggestion. We're not DCFS. We're just saying, here's something that could maybe help your teenager. Or here's a parenting class, or there's a food pantry actually at this church that's literally in walking distance of your apartment. That what I found is a lot of the social workers don't know some of those faith-based resources. But again, it's not imposing faith, not telling them they have to do this or conditions or awkward faith conversations. It's not that at all. It's at the pace of the family. So some families get connected with a faith or a church or that type of thing at their pace, and some don't go there at all. But again, it's just how do we, like, I would say almost double the amount of resources because there are a lot of faith-based places in each community that can provide some layers of support if the family's interested and at their pace. Any thoughts on that, Michael? Because I know for some people this is a little bit of a delicate piece for some people. Any thoughts you want to add to that as a county worker?
Well, one of the things that in the state of California, we've been mandated to do the Child Adolescent Needs and Strengths tool. And in that tool, they have spirituality as an identified strength for the family. So I don't see it as a conflict, as maybe some people historically may have done that. But it's been a great resource. And also I've had Pastor Dan come do presentations to our staff about the importance and role of spirituality in
Yeah.
people's lives.
So that's been part of the conversation is I actually do a training. I've done it for nonprofits, and I also do it, like I said, for Michael's office and other offices on how to work with religious families. And what I found is there's been a lot of good stuff out there on like cultural issues, and those are needed. But what I found is some of the faith-based stuff, there hasn't been as much how to talk and connect, because I would say families of faith, it can be a really positive sense of strength for some with hope, but honestly, it can be a real negative thing, and there can be a lot of rigidity that can kind of get in the way, or some division within families, that type of thing. And so, what I've found when I've done this training for social workers, I did some training, I remember, from some brand new social workers. Most of them had just gotten their degrees, and almost all of them said, I purposely don't bring up spirituality and faith because I'm afraid to offend somebody. That was kind of their top way of thinking. And I thought to myself, that's kind of sad, because I actually would be considered unethical if I did that almost with any other part of a family life or a personal life. I don't bring up culture because I'm afraid of offending, or I don't bring up sexuality, I'm afraid of offending. Like, no, it's helping the whole person, the whole family, that type of thing. And so it's really about how to really just help the whole family. And for some families, again, not all, some families, their spirituality is probably one of, if not the most important part of their life. And it's a place of resource for them. So again, it's not imposing faith at all, but it's just actually adding more resources out there that maybe your average school counselor or social worker doesn't know about. It only if the family is interested or desires that. Again, it's at their pace, that type of thing. All right, again, I want to pause. I hope there can be a little interaction or questions or what if or what about. Any thoughts or we'd love to see this in other areas, just because we're just thrilled about what's been happening in the Santa Clarita area. Karen, I see a question or a hand.
Hello. So I guess I'm trying to figure out, and I apologize if you've already covered this. I feel like a meme now saying that, but um, I'm trying to figure out exactly, do you have sessions with them, or do you just help them connect to resources?
Oh, it's a
Because
good
we have
question.
no resources in our county, literally no nonprofits.
Hmm.
And so I was hoping to use the faith-based as sort of that
Yep.
resource.
Yep. So yeah, we're really clear. This is not providing any therapy or professional help that way. The people I hire are not professional licensed therapists. A lot of them actually have a background in education, like retired principal kind of individual.
Mm-hmm.
And so it's more about connecting them with a resource that they're comfortable with. And some of them, there's so many more growing online resources, whether it's a substance abuse resource or domestic violence or grief support or whatever it is for that family. But I would recommend definitely some of the faith-based resources. And by the way, I'm going to speak on how to connect with a faith-based resource or church or whatever.
Mm-hmm.
Do not just send them an email saying,
No.
we have a referral base thing. Can we add you to it? That does not work well, because again, it's two different cultures. It's two different worlds at times. What I would highly recommend, and social workers are really good at this, go to them. Go to them, just like in social work world. If you really want to get to know the family, do you have them come to the office, or you go to their home or apartment or wherever they live? You go to them, and you get to on their turf. So I would highly recommend, if there's like a local church, Karen, in your community or a couple of them, you say, can I come and meet with somebody
Mm-hmm.
at your congregation who does probably stuff related to community, reaching the community? And can I just get to know what you do, what you provide, what's something you're proud of as your congregation? And then you get to know us and we just connect. I would start there, and it's amazing what can happen, and just being relational and just kind of that human way, that type of thing. So I would definitely try that, and they'll actually be pleasantly surprised.
Yeah,
Uh,
so Pastor Dan, there's a question about how did our collaboration start? And honestly, I don't remember exactly how it came to be. And if you introduced yourself to me or I came to you because there was something, but we just would go to lunch and we would talk about what we wanted to see in our community. And one of the things that became very, very clear is that we both had a vision for what our community could and should look like. Because we know, and talk a little bit about the Santa Clarita office. We're north of uh, Los Angeles, and it's a suburb. And sometimes we don't have a lot of foster homes. So if a child has to go into foster care and there's not a relative right there, sometimes we have to send them miles and miles away. And that's obviously the disruption to their school, to their friends, neighborhoods, all that kind of stuff. So Pastor Dan we joined together talking about we wanted to keep our community strong and together. And that's been basically the foundation. Plus, we talked about getting putting DCFS out of a job. But we believe that putting our faith and our efforts into our community, we're able to keep children out of DCFS, and it's worked.
And some of the things we've also done is like our church actually has provided like a brunch for the staff, the social workers. I always think food's a good thing and kind of doing stuff. So you might have literally a lunch for faith leaders in your community and say, let's invite 4 or 5 and just get to know them and build some bridges about what they offer for the community or what they're proud of their congregation or what's the strength, and they do the same with you. And so another thing that also I'll add that we do is we actually do something called the Compassion Network in our community. And the Compassion Network is just think of speed dating meets networking. All right. And so what happens, we had one, I think our last one was in November. We had 70 individuals from Boys and Girls Club, social services, chaplains, pastors, law enforcement, psychiatric nurses, substance abuse counselors, all come in one room, and they get in groups of about 5, 6, 7 people, and I have them actually all connect for about 15 minutes, and I go break, and then they go connect with another group. And it's actually been way more effective than I think a resource fair, because people go into this profession to connect and be with people, not just to get information only. And what I find is when I connect with someone a little bit in that compassion network, I end up referring to them far more often because now I have a little bit of a relationship. I know their first name. We've connected a little bit. And now it's amazing how when something comes up, I remember them better versus just, oh, what was that one website again? When it's information only. And so we end up doing this now twice a year in our area, and we're actually starting it. We just did in other areas of LA County. And so what we're finding is you usually do it for about an hour and 15 minutes, and everybody complains it's not long enough, which is the exact opposite of a lot of meetings of when is this over? Because people are like, oh, I had no idea that you provide this service for adoptive parents, or I had no idea that you do this for families with special needs. And we're like 3 miles from each other in the same town. And so that's just been another way of connecting these two worlds. And then it takes the pressure off that not any one organization or even social worker has to know it all or be it all for any family, because there's a lot of other good community partners that are out there.
Hey, Pastor Dan, there's a couple of questions in the chat. One is an outline of the help that you provide the families specifically, and then also how are you funded?
Yeah, so also anybody, if you want, I put my email in the chat. If you want to send me an email, also copy other people's email. You can even have a copy of the slides. I'm really fine with that. Now, I actually feel bad for the funding part because it's probably not the easiest to replicate. We are actually working with a couple other churches in Ventura County, Kings County that are considering starting family stress support also. And for us, it actually started out because I had a friend who just said, I'll just fund this. So I realized that's not the most encouraging answer. And some are like, can I be that person's friend? So I realized that's not the easiest answer, but what I found is there are churches that actually want to help the community, but the whole DCFS system is pretty overwhelming and actually can be pretty intimidating. All the acronyms and court issues and legal issues. And so what happens is I think that these congregations want to help, but they're just not sure how. And so I think it becomes intimidating. So they go, let's go try something else. Is what I've seen. So I'm actually working on some foundation stuff to try to get more funding to do this, to maybe work with other churches to do this. So I realize that's not the best answer that solves everybody's problem on how to do this.
But what I will say to that, though, is part of why we're going around the country talking about this, because we do believe that there are philanthropic opportunities out there to support this in the community, because one of the things that Pastor Dan and I have been very clear about, do not take money from us. We do not want you to have any money from DCFS, because families will say, well, who are you funded by? And if they say by DCFS, a lot of families will believe that they're an agent of DCFS. So we really wanted to make sure that Pastor Dan was completely clean from any ties to funding directly from DCFS.
Great. Any other questions? I thought there was one or two other questions that was popping up.
Yeah, Dan, there was a question about outlining, like, what do your case managers do with the families?
Sure. So, our hope is when I get an email from a DCFS social worker, school counselor, it comes to me, and within literally 1 or 2 business days, I will assign a case manager to the family. And the family will already know that they're going to be being reached out to because they've been told by the social worker and they've been asked, actually. The family's been asked. And so they will call them up and say, I'm part of family stress support, and they'll explain what they are trying to do. And the first really big thing that the case managers do is just ask them, what's going on with your family? What are some of your needs? And what are the stress points? What's going on? And it could be they're worried about their kids' education. It could be a substance abuse with their teenager. It could be they just left a domestic violence relationship. There's all sorts of myriad of issues. And the goal is just to meet the family where they're at and find out what are their top stressors. Because as you know, when a family has these multiple layers of stressors and there's some past trauma, the chances of having proactive thought are really small, right? They're just in survival mode. And so the goal there is just to be reassuring the family, saying, are you okay if we kind of try to find maybe a support group for someone with past domestic violence? Are you okay if we find maybe a healthy resource for your teenager? It sounds like you need some food. And because we don't have red tape, we can deliver food to their residents. We also work with another agency. We will actually help pay their rent or their car bill. We have some other funding that way through a place called Change Reaction. And so one of the things I have found, and again, it's nothing against those social workers from DCFS or the school counselors, is because we have access to some of that funding through Change Reaction, and we're connected with the faith-based resources, we've almost like doubled the amount of options or resources that we can maybe provide to a family. And so, there has to be sustainable income to pay the rent, but we can help them. And again, that then is helping prevent some homelessness, because sometimes just life happens, or between jobs or whatever it is, and they need help, and we can help them. And so, or it could be the simple thing: it's my kid's birthday tomorrow, but I have no money for a cake. Well, let's go get a cake and do something for that family. And so the goal is just to meet them where they're at and literally let the family say, here's our biggest needs and stressors, and how do we figure out how to do it. And the other thing is, because we're part of like a faith network, sometimes the case manager will know someone within like their church that owns a business that can maybe hire them for a job. Like there's all these other kind of what I would call non-professional relationships. They're non-formal relationships, and every family needs more than just formal relationships. If their only relationships is their DCFS worker, their doctor, and their teacher, and there's nobody outside of that, that family's really not going to do well. They need informal connections with other families or relatives. And so, again, we only go at the pace of the family if they want this. We'll say, hey, I know of this thing that might be able to help, and they're not a professional, but they do this thing, they hire people. Okay, can we connect you? Or, hey, I call the school principal on your behalf. I'll ask for an IEP on your behalf, but only if you want me to. And so it's really just it's not coming in with like this agenda. We have to offer only these things. It's really going, what are your needs? What's really going on? And every family is different, and every family is different at the pace that they want help to. Some families like, I just want to find this one thing for my kid and that's it. And some are like, I need help with 4 or 5 things. And it just so depends. And then we figure out literally how to help them. Michael.
And this is why there's so much magic to this, because again, the families are coming to us with a general neglect designation, right? Okay, so we're not talking physical abuse, we're not talking sexual abuse, we're talking general neglect. And what we often find with our general neglect families is that, yeah, they're struggling, but it's not a big struggle now. But if we don't do something about it, it's going to become a big struggle. So the opportunity to intervene earlier, and when it's like a simmer instead of a full on boil, it really makes the opportunity so much more impactful, because then they never have to come back to us. And in all the years that we've been doing this, none of the families that we've referred to Pastor Dan have come back to us. So it's such a great opportunity to help families when they need it and not when they qualify for it with DCFS.
Good, good. The other thing is, we never are, honestly, from a personal perspective, I never really care who gets the credit for things. That's not, I've seen some situations in some agent areas where it's like almost competition for like who gets what, and I know that's a little bit of a delicate thing. And so to me, it doesn't matter. If we refer to other agencies and they can't get their credit for helping that family, great. That's a win for the community. That's a win for those children. The only criteria for us to be referred is they have to have a minor in the home. So it could be a grandparent raising a grandchild. They have to have someone under 18. So we do not do this for the 25-year-old single individual who doesn't have any place to live, homeless. So they have to have a child as part of it. So that's really our only criteria. And for us, we do it in Spanish and English. And again, just trying to figure out what else is out there. So we're constantly also figuring out what other resources are out there. And what I've been told, this is the feedback I got from my coworkers, is I'm constantly inviting myself over to other people's lives. Is kind of the feedback I've been told. So for instance, last week there's a school in our area that does education for individuals who dropped out of high school, for adults, basically, to go back to get their GED or complete high school, or go back to get a certificate program and to get a better job. So I just, email their head counselor and their principal, say, can I come meet with you and talk to you about what we do? And I could just tell they were suspicious at first. And they basically are like, pastors from churches don't just ask us what we do and want to like come meet with us and figure out how to work together. You get a sense it was like, that's not typically what happens. We talk to just other schools or charter schools or, the local junior college. So it just takes time to build those trust relationships. But what we find is the more you work together, then you're referring to each other, and it's a win for everybody. It's really a win for anybody. Anything else you want to add to that, Michael?
Well, I think especially for the schools, the win is for the schools, because they are able to refer to Pastor Dan directly, and the family is able to stay together. And it also doesn't disrupt the school relationship, because when a teacher has to call DCFS, oftentimes the family can figure out who called. And sometimes that creates a disruption in their school and the trust. And again, having the ability to refer to Pastor Dan before it becomes a bigger issue has really, I say we're trying to swim upstream as far as we can. And the idea is that if we're able to intervene earlier, they'll never make it to us. And that's what we're finding. We're finding that the families aren't coming to us, especially those cases that we used to call and still call general neglect. We're only getting the hardest, most severe situations that require our immediate attention. And the great thing is that because we now have a reduction in the front door, we're able to spend more time with those families and really do everything that we've wanted to do and are supposed to do. So it's been a real big win for the schools as well.
So like one of the things we do with the schools is once a month in our area, they have a meeting for truancy issues right? And there's, I think, one of the school psychologists is there, the social workers there. And so we're now actually part of all of those meetings. So if there's a family with a truancy issue with a junior high or high schooler, we're actually part of those meetings, and feels like 3/4 of the time they get sent to family stress support, because the reason that teenager's not going to school is there's always multiple layers of it going on in that family. There maybe was a loss, there's a delicate divorce, or there's lack of, they want their 15-year-old to get a job with them at their business because financial things are really, really tight. And so what happens is, again, that's part of the prevention part, is actually joining those meetings with the local schools, because if things get worse, often it can turn into a DCFS referral. So again, part of it is just trying to think, what are those systems in the community that often refer the most? And so school districts, I know, have one, I think, Michael, correct me if I'm wrong, the highest rate of inconclusive or unfounded referrals for child abuse or neglect. So, but they're doing it because they're covering their back. They're told they have to. And again, I know you need to sometimes. I'm not trying to get in the way of those referrals when needed, but sometimes it was really about there's just needs more than there was abuse. All right. I don't think we have any more slides or anything like that. Is there any questions or anything to clarify, or you want to ask Michael the tough questions or anything? All right.
So I guess my
Any-
question to all of you is what do all of you think about this? Is this something
Feedback,
that
yeah.
you might want to look at in your community?
I would say in our community, we are working on prevention planning at the community level, and I would say that I would probably bring this back to the prevention team. I know that it has been a topic about working along faith-based organizations. We just haven't reached that yet, but I'll definitely be sharing some of the information that was shared today from this workshop with the prevention team, and seeing how we can collaborate or just join in on what faith-based organizations are already doing in the community.
And I also want to reiterate, I realize there's some faith-based places, some churches that would not be great to work with. I realize that. I mean, even my own church, we actually have a support group sometimes called Church Hurts, where people hurt by past church experiences. So I get that there are some places you meet them, and within 5 minutes you're like, oh, I don't think we could even go there. So I really want to be sensitive to that. Once there's some that's just better than others, and that takes time to get to know them. Who's better to work with than others, and who you feel like you could trust, because trust does take time. And not all churches, I would say, have levels of emotional safety, even that type of thing. So, and by the way, if anybody's ever interested, I've done this with other counties, and Michael is willing to also, is if you ever want to do a Zoom call with like a local, like pastor from a church, and yourself from social services or someone in your community, we're glad to jump on a Zoom call. We've done that before and just talk through how could this possibly work, or if they have questions, because pastors or church leaders, they can be pretty nervous too. Like, wait, is DFS going to start telling us exactly what to do? And, I hate to say this, but after COVID, people are just more suspicious, in general, and for different reasons. This is not a political conversation. So I just realized that's just a reality, I think, of where we're at after the last few years. So always glad to do that. All right. Anything else, Michael, you want to add to wrap up? Oh, you're on mute still, Michael. Yeah.
I see some questions coming up in the chat.
Okay.
Let's see here. Oh, nice, inspiring. Let's see. If anyone works in Contra Costa, Alameda, the greater Sacramento area, or nearby counties, ooh, there's a reach out. That's great. And I think one of the things that
Oh, you're on mute,
I
Michael.
know I
So
went on mute all of a sudden, is really the partnership with the community. So Pastor Dan also spoke about the what we kind of referred to as the speed dating of community providers, the Compassion Network. It's really opened up people, and by doing what we've been doing with Pastor Dan, people don't see us as the historical DCFS. They don't see us as the bad people anymore. We are actually seen as a resource. We're seen as a community partner that is necessary. We get thank yous from families now. We get invitations from community partners that we've never had before. So it's really transformed how people view us in the community, because they don't see us as just coming in and grabbing. They see us as engaging in a thoughtful process to see what is it that we really can do to help this family stay together, rather than maybe how DCFS historically was known in the community.
and some of this is, there's sometimes there's family team decision making type of conversations that we'll be invited into also, or even sometimes the staff at DCFS will actually have a staff meeting at our church. And again, it just bridges conversation and those type of things. So just like any relationship, I think it takes a lot of intentionality, though. Those relationships don't happen through random emails or a good website and that type of thing, but really some intentionality of those type of things. Well, also, I know I will put also on the screen, this is both the best way to reach Michael and I, if you want to, that's his email also. And so we'd love to help in any other county if we can, or talk to your supervisor or faith leader or whatever that is. We're glad to just hopefully collaborate. And I'm just thankful for even this conference and the focus on prevention. And there is such a need for prevention, and the more we can do that, I think that's just a win for all of our communities, and it's a win for families and for children. And we're just thankful to be part of this, part of the conversation today. And like I said, reach out to us in the future, and hopefully we can connect and see how we can help. Thank you very much for joining us. Hope you have a great rest of your time, and hope it's a great rest of your day. Thank you, everybody.